When talking about difficult children, I was able to reflect a lot on my past and my work experience. The first child that came to mind when thinking of this prompt was in a summer camp setting. I was working with military families at the time, and a lot of the children I was seeing were in single parent households with their fathers or mothers, at times deported in Iraq and other military bases. The child that comes to mind specifically was one that was struggling with a father who was in Iraq as well as an ADHD diagnosis. His medication that he was on was not reacting correctly with his body, and he was often struggling a lot with paying attention as well as interacting with peers and the other adults that were working with him. He was one that would disturb others, and he was usually isolated from his peers and often bullied and ridiculed. I made it my duty to really help him, and with that, I chose to, instead of isolating him or treating him differently, I would make sure to be with him as much as I possibly could. As hard as that was at times, I definitely saw a benefit to this. I would pull him out of the group settings at times when he was having some attention problems, and I would really practice on one-on-one time with him, which I definitely saw benefited him. I would really practice positive reinforcement with him and praise him during these group times when I saw him paying attention or doing something positive. I also made sure to have a relationship with his mother, which definitely helped, and this really helped boost her self-esteem because I know a lot of the adults that worked there were constantly nagging her and telling her how challenging her son is, and I really just made sure to focus on the positives and sandwich those positives to really have a productive relationship and hopefully see some outcomes. If I could have done something differently with him, I would have hopefully started these strategies a little bit earlier so that I could have seen more results towards the end of the summer, because it took me a few weeks to realize that taking him one-on-one could potentially help him. So if I would have started a little earlier, I could have seen results quicker. The second child that comes to mind was in an early intervention in-home setting. I was working with a child who is from a low-income, generational, poverty-based household, and he didn't really have a lot of access to nutritious foods or anything along those lines. So I also observed him demonstrating some violent behavior towards adults, particularly myself, which was definitely the biggest challenge. When working with him, I practiced extinction, which is pretty much planned ignoring when he would get physical with me. And this would allow myself to avoid any big reactions so that he would know that that attention is not going to be given to him, and that can hopefully help him understand that he's not going to get any praise from those actions and those behaviors. I also would praise him when he was gentle with family members or adults and when he would show respect. I would definitely keep the attention geared towards those moments. If I could have done something differently with him, I would have found ways to educate his family and bring them into intervention a little bit more and kind of create a family-based intervention plan, because a lot of these behaviors, I realized, are being taught and being learned from him observing the adults in his environment, and I've learned that both through experimenting, observing, and also in my higher education courses. So if I could have included her a little bit more in the intervention, I could have seen more results quicker from him, and hopefully when I had left the home, his parents could have potentially practiced that a little bit more.